with
can
the
start.
introduction.
You can start if you want.
Okay. Well, I'm excited to be here with you this evening. We'll do some quick introductions. My name is Montika Collins. I am a nurse. I'm an RN. I have a bachelor's in nursing. I have a master's in health and wellness coaching with a concentration in medical herbalism. I'm also an internationally board certified lactation consultant. I'm a CLC as well. And I work in private practice, seeing moms and babies. I also teach at Oral Roberts University. I teach community and leadership to nursing students there. So I'm very, very passionate about food health, food security, that breastfeeding should be the first food, and that we should be very aware of the different cultural differences and the importance of just foods that are native to specific cultures and how they have helped us to develop, over the centuries. So I am really, really excited to be here with my friend Hilary Jacobson.
Mm-hmm.
And yeah, that's a little bit about me.
Thank you. We're going to get this going. So, my name's Hilary Jacobson, and I'm a musician. My first degree is in music, and when I had breastfeeding problems in the 1980s, I was living abroad in Switzerland, and I set about resolving my breastfeeding difficulties with foods and herbs. And I learned about European herbology, and I learned um, about Ayurvedic and traditional Chinese medicine, herbalism for breastfeeding, and I was able to um, use foods and herbs in multiple ways to not only help with milk production, but also to equalize my mood and to stabilize my baby's digestion, my own digestion. And when I saw that there was this whole science that I had developed over the course of like 4 babies, and I was really good at it now, I figured I've got to share this because I recognized at the time, this was the 80s and 90s, that no one, in Western society was talking about this. And in fact, that
Mm.
it was even taboo, right?
Mm-hmm.
So I was studying that, and at the same time, a school of holistic lactation was developing in Switzerland. So I certified in that in the year 2000, and went on to work with breastfeeding mothers who are having, in particular, low milk supply problems, but a lot of other issues as well, online mostly. In our group, Mothers Overcoming Breastfeeding Issues, that was our Mobi group, and published my first book, Mother Food, in 2004 the first time, 2007 the second time. Anyway, um, I returned to the States in 2007 and was able to realize a dream in 2013 when I certified as a mindfulness based hypnotherapist in a
Mm.
school that had just opened up close by. And I began to work with mothers emotionally, with their emotional issues with breastfeeding problems, because what I saw in all those years working with mothers online was that even if they got kind of overcame some of those initial struggles, a lot of times the emotional residue of that period of struggle and perhaps failure, loss, devastation continued on for months and months and sometimes for years. And so I had hoped and prayed to somehow learn a way to help mothers. And when I learned hypnotherapy, I realized I now had the tools to start doing that. So I began to focus on that, and I published my book, Healing Breastfeeding Grief, um, in 2016. So those are the sort of like the two parts of my work. And so I consult mothers online I usually combine both. So if a mother comes and she's kind of still struggling with different postpartum issues, I'll work on the herbals and the food part, and then as well work on the emotional part. So that's what I do. And the pandemic came, and I recognized as it was going on this deep desire to somehow share something that would help mothers who were kind of indoors and unable to go outside, or who were limited to the house and yard, and that I would write the book that I had always wanted to write, which was how to grow and use foods and herbs that grow around. A lot of them are growing all around us all the time, and we don't recognize them. So, how to use those things to support milk supply, how to grow plants at home and in our garden that we can use all year round to support milk supply. So, anyway, that was the last project that I published in January of 2021, and I'm excited to share that now with moms. Yeah. So,
I'm super. I'm excited too. I can't wait. I actually haven't had the opportunity to dive into that yet, but it is on my list of things to do next because I tried my hand at growing things during the pandemic and learned very quickly that I have too much shade. So I need to find another spot to put my garden in. It started off really strong. And then as the trees filled in, I was like, oh, and my tomatoes were like, help. And they were just
yeah.
growing up and up and up, trying to
Yeah.
get to the
Figuring
sun.
out
So I was like,
figuring out the light in your environment is the
mm-hmm.
first step. Yeah. Yeah.
Yes. So yeah. Um,
So
would you last?
we know each other, first of all, through Jennifer Tao's courses, where I
Yes.
have lectured on the history of low milk supply and basics of the lactogenic diet, and that's where we met.
Mm-hmm.
Um, and our motivation is to be able to share information that people don't ordinarily get to hear. It's usually the back room talk, sort of we get together and we talk about all these things, and it's like always in the back of my mind is, oh, I wish these conversations could be available
Mm-hmm.
to, well, primarily to mothers and also to other healthcare providers. So
Yeah. Yeah. No. I mean, we have these conversations, and I feel like it's necessary for, there's all kinds of organized information out there to where you can, go and buy a class or go and do, a webinar and so on and so forth. But I feel like a lot of times within the candid conversations of me and you, or even when I'm talking to Jen, like we get into these super deep discussions about things um, that I feel like are things that really need to be shared, with other folks, um, and not in a paid situation, to where this information is available for anyone, because it's really the building blocks, of life and things that we're going through as individuals, so that we can have, a healthy, strong, confident, society and people. It's when you were talking about healing yourself with herbs and foods, you even mentioned mood, and I feel like that's such a big piece that we miss. And it's Mental Health Awareness Month. I don't know. I just feel like that's kind of fitting too. That
it all fits
that we're
together.
yeah, that it all fits together. If you there's so much power in the mind, and I've seen so many people, with you, just that when you don't have that hope to to continue to push, you know what I mean? Or that hope that you can get better, or that your body is capable of healing, and healing itself. But we have to support that inner healing, right? And you do that with your mental stability, with your mental health, with the foods that you eat, uh, with various herbs, so that your body, and with rest, right? We talk about rest all the time too.
Yeah. Right.
Getting in that space to where you actually, can heal. Because if you're just consistently just going, um, that makes things difficult. And I don't know, even with what we were, when I told you before we got on the Zoom call today, I got some news about one of my aunts who is the oldest, I think, left in my family, but she's been blind for a long time, but she's been getting around, even though she became blind. She wasn't born blind, and she became blind, I would say, I feel like had to be in her adult years, because I think I remember her being able to see. I'm trying to think, but I can't think of that right off. But she lived by herself for so long and always floored me, um, when I would go over there and she, be making potato salad or something, boiling potatoes on the stove. And I'd walk in and I'm just like turning on lights. I'm like, I can't see anything, but she knows where everything is at in her house. She can work her stove and all of the things. And so at this time in her life, with her transition, um, yeah, the conversation was just that she's ready to do that. And so then you have this whole conversation of, okay, if you're ready to transition, um, doing that with grace and doing that, feeling the best way that you can. You know what I mean? Because
And
so many
now
people.
we're going to go off on another tangent
Oh yeah, so
because right, but conversations are full of tangents, aren't they?
yeah,
I
yeah,
had to think that when my children were young, I was losing some of my favorite old people.
yeah,
And it's such a strange place to be in as a young parent. You're welcoming the new family members, and at the same time, you're saying goodbye to others. And it's
yeah.
I think it's really a precarious place to be,
It
actually.
is. I do.
Yeah.
I agree with that. I feel like we've lost, at least my family, we've had quite a bit of loss lately. So I don't know. I think that's kind of overshadowing, the conversation a little bit for me, but I also think that it definitely is coming from a real place. And I know that when we first said that we were going to do this, that we wanted it to be from a real place. And we wanted it to be, those candid conversations and those vulnerable conversations that we can have and share, with people, and really come from a place of, not only are we saying these are things and concepts to help you live a better life, but they're also things that we are implementing with our own families, with ourselves, to help us get to a place, to where we're living, better lives, and better lives for our children, and our loved ones, because when I even think about my aunt, she has, kind of, just jumping over on another tangent of what we actually were saying that we were going to talk about tonight, when we're, talking about the medical establishment and the different medications and things that she has been on, for so long. Um, you really want to, I don't know, it's a place where I'm like, ooh, I wish I could do this, that, and the other for her. But then it's also a place of, she's in the hospital now, but I know that they're saying that they don't even think they're going to admit her. She wants to come home on hospice. So right now, I can't really interfere in what's going on with her in the hospital. But again, making that time that she has at home on hospice, as comfortable, um, and helping her to be as comfortable as she can as she does go, like I said, through that transition, um, the way that she wants it to be. You know what I mean? And that's going to look different, you know, for everyone. Um, yeah, it's going to be different for everybody. And I definitely, I will say that I've been here before, and it's a difficult place to be. But then I will say that transition and ushering someone into that into death, but that eternal life. And also I've been in that place of, you know, being a mom and being with people where that life is coming, you know, into the world. And it's two different things, but there's beauty in both. You just have to, sometimes it's harder to find the beauty over here, but you know, I don't know.
I
That's
remember I
just
remember
my
my
mind.
I remember my midwife when I was giving birth to my first child. I think afterwards saying, every birth is like a life and death situation
Yeah.
because you as the birthing mother, you feel that you're like right at that precipice somehow. It could
Mm-hmm.
go any way, right? And there's that sense, there's that
Yeah.
feeling of it. And there's also that transition. And what's special about the transition, let's say out of this world or into this world, is it's finite.
Yeah.
You can say you're growing up for lots of years, or this phase takes so many years. When you're born, it's just right there, right?
Yeah.
And those couple first months, or even I'd say the first week, the first 2 weeks, it's a very unique time. And the first couple of months is a very unique time, and afterwards it's gone,
Mm-hmm.
right?
Mm-hmm.
Yeah. And it's
Mm-hmm.
very, it's this, yeah, it's the same thing with death. It's over when it's over. And
It's over when it's over. And even that time, you know, like you said, that few months, if you know that it's coming, right? Of course, there are times when it's immediate, you know what I mean, and unexpected.
right, yeah,
Um,
yeah,
but then at other times, you do have situations where you know that it's coming, you know what I mean, and you
sure.
have those couple of weeks leading up, until the end. So situation, every situation is different,
Right.
right? And that's interesting. Like, I'm even just thinking about what you said about that first few weeks after having a baby. For everybody, it's different. You know, for every mom, for every breastfeeding relationship or a relationship where breastfeeding isn't able to be established. You know what I mean?
Hmm.
Because you're birthing, a baby is coming into the world, but also that mom is being born too, right? Especially if it's a new mom who's never been a mom before. You have that experience of, okay, like I've never been this before. So as that mother is being born, because that mom, you were never a mom, you know, you were a young
Yeah,
lady, and
yeah.
now you're a mother, you know,
And what
caring
do you
for.
always, I mean, not everyone says this, but you hear it often, is that you never knew that you could love so much.
Oh yeah.
And not
Oh
everyone
yeah.
feels that, of course, but if you do feel it, it's like you never expected it.
You never expected it, and you never, for those of us that have multiples, it's amazing that the love isn't split. You know what I mean? It's not like it just grows. You have more love. It's not like a piece of a pie. You know what I mean? It's not that
Yeah,
every person, every
yeah,
child gets a slice. It's a whole new pie for,
yeah. And
you
you
know what I mean,
discover a whole new
for
part
each
of
baby.
yourself that responds
Yes.
to that child, each
Yes, and
child differently.
they're also different. I look at my three, and you had four. That's
Hmm.
super awesome. But I look at my three, and I'm just like, well, I say three. I have three earthside and two in heaven, but it is definitely, they are just so different, and it's so amazing. My breastfeeding experiences with all three of them were
Hmm.
completely different.
Yeah.
You know what I mean? Completely
Mhm.
different. And I will say that even with that, when you're talking about your mood and becoming a new mom, the one that was the most difficult for me happened to be my first one. You
Mm.
know, she was the first, she was the one that had, you know, the colic and the tongue ties and the eczema. And, you know, I didn't know then what I know now about, you know, how the medical establishment is set up. And, you know, I just kept having people tell me that, oh, well, she's just a colicky baby. You can just lay her down. And it's okay to just, you know, walk away from her so you can take care of yourself. But for me, that was mentally, it was more difficult for me to lay her down and walk away than it was for me to hold her through that, even though I couldn't help her through that time. You know what I mean? And it took me coming out of traditional Western medicine, I should say, um, be, to actually start finding answers. And I met a gentleman that was a medical doctor, but he had left the hospital setting, and had went back to school for naturopathy and something else. But he was the first person that ever asked me to um, basically do like a food diary. And he had me write down everything that I ate like for an entire week. And I brought that to him. And he looked at her, looked at me. Um, at the time, I didn't understand that what he was doing was muscle testing. But now, when I think back on it, I think that's what he was doing. And told me that she was allergic to dairy and cinnamon. And I just thought the cinnamon was super random. I was like, cinnamon? I don't even think I eat that. But yeah, I got used to that's my oldest. She used to scratch her neck until it would bleed. Her eczema was so bad. And I would say that she was like, I don't know, probably 6 months old before we really started getting to a point where we had some answers. And the what our ped had told us, you know, it was always steroid creams, put this steroid cream on it, use, you know, um, if the uh, Eucerin, I think was one, I think Lubriderm was another one, but everything was topical, everything was external. No one was addressing the fact that, you know, eczema is a reaction to something going on in the body. You know,
Mhm.
that your
Right.
body is saying, I don't want this, I don't like this. It's you know, an allergic reaction to something. And yeah, he was the first person to do that. And so I had to change my diet and
You
really learn how to change it, you know.
you were
And
lucky that you found someone.
I was, because so many people don't. And he had like this serious talk with me about cutting dairy. And he was saying that doesn't mean that, you know, you just stop drinking milk and stop eating cheese, that you have to read your labels. And, you know, the dairy hides in casein and whey. And, you know, you have to pay attention, you know, and that, you know, cutting the processed foods, because most processed foods have some form of dairy in them as a filler. And so I started on this journey, and that was 15 years ago.
Mm.
And you know, I when I cut it completely, her that spot on the back of her neck that used to bleed cleared up in like 2 weeks. And I was amazed because that was the first thing that ever worked. And she, you know, continued to nurse, and she nursed until I think she was 3 years old. And but I had to watch my diet, watch what I fed her. Um, and food was our medicine, you know. And I
Mm.
know that that's something that um,
Look.
people hear or say, look at that. Exactly.
So
You know,
this is a book by Henry Beeler, and it's from, I think it's from the '60s. It's one of the early ones. But what's interesting about it is he's writing as an elderly doctor at the time. Oh no, his first edition is 1982. But oh, no, I was right. Originally published 1965.
Oh wow.
So, so he's writing from a time that's before our time. And it's a time where doctors were very hands on, very involved, right?
Mm.
So I'm going to just see if I can do something here. Pin, can I do that? Add pin, place pin. Ah, there we go. um, there we go. So, right, getting the hang of this. So anyway, Dr. Beeler wrote that that it was his observation that the firstborn children had the hardest time.
Mm. Oh wow.
Right. And later on, when I was researching in the 90s and the early 2000s, I remember reading that allergists were talking about this, that the firstborn child tends to have the most allergies, to be the most sensitive gut, to and the truth is that the first baby is like a sponge, and
Mm.
that baby sponges up and takes into him or herself the toxins that you are releasing in your body during pregnancy. And so each baby is like a detox possibility for the mom, which isn't
Mm.
very good for the baby, right?
Right, right.
Not such a good idea. So, the idea of, I don't know who said it first, but it's detox is always. We should always be doing something in our lives to prevent inflammation and to detoxify ourselves. So it's not only being exposed to toxins, it's eating sugar, refined foods, et cetera,
Mm-hmm.
having electromagnetic fields close to the body. All
Mm-hmm.
these things contribute to inflammation, and the inflammation prevents the body from being able to do its normal detoxification methods as effectively as it would if that inflammation was not there. So you've got, those things, toxins and inflammation going at the same time. And he actually has a detox soup in here, a spring soup, made with greens, etc.
Mm-hmm.
But anyway, it was a really interesting book to read what a doctor in the 60s was saying about family health. Recommend it.
It's so great though that the conversation was being had then. um I just feel like, things, we get into these cyclical patterns of things, and I hope that we are coming into a time of healing, you know what I mean, and people really understanding that. Even when you were talking about his book and that first child, having a lot of um getting a lot of the things, whatever that mom has been doing. I've always found it fascinating that, well, not fascinating, but interesting. I don't know what word I want to say, but that we tell moms, not me and you specifically, but as a society, a Western society, that, oh, you're pregnant, you can eat whatever you want. You know what I mean? This is the time for you to just, whatever you want to eat, whatever you want to do is absolutely fine. And really, you're growing a human. So, if anything, your childbearing years should be the healthiest part or the healthiest times of your life, right? As far as what you're eating, what you're putting in, detoxifying your body as much as you can before you even get pregnant with that first baby, instead of, waiting or, doing whatever you want in your youth, your early, adulthood, and then you have this baby, and then you eat whatever you want to eat, the refined sugars, the ice cream, the all of these different types of things, that really aren't supportive to growing a human. Have we talked about, there was a PBS special, and they followed, I believe it was, I don't know if it had to be in Africa. They followed a tribe, and they were taught in this tribe, children where the mothers were pregnant during the rainy season when things were lush and there was, lots of, greens and food readily available. Those children that were born during that, or that where the parents were pregnant during that time, versus the children that were developing during the dry season, where they were, relying more on, I think it was like corn and millet, but not the fresh fruits and vegetables and the lush things. Just how you could tell within the village, and the people could tell um, who was gestating during each period. And I just found that fascinating, that the ones that were nourished during this time were healthier and stronger toddlers, adolescents, and adults, versus the ones that didn't have that same nourishment. Even afterwards, they went through seasons, of course, just like everybody else, of having that time of getting lush foods. I mean, once you're born, but they never caught up, I guess is my point. They never caught up to that strength and resiliency that those infants that had that gestational time during the rainy season.
Right. You see that with plants. If you get some plants from, let's say, from the garden store, and the one that goes in the ground right away, and the one that doesn't go in the ground, and maybe it goes through a couple of days of not having optimal water and everything, you'll
Mm-hmm,
see
mm-hmm,
those two plants are going to grow differently, even though they started, let's say, from the same way. And these are facts of life. It's
mm-hmm,
it's
mm-hmm,
it's 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 just true. We have studies also about the seasonality of diseases. um, I think, I don't remember exactly, but if you're born in one season, you're more prone to schizophrenia. If you're born in
oh wow.
another, yeah. So we know that through studies as well. But the thing is that human beings have something called consciousness, and that means even if we start with, let's say, disadvantage, with hunger, our mother didn't have optimal this, that, or the other,
Mm-hmm,
when you
mm-hmm,
develop your consciousness and you come into your own being, which is, what the work that I do with hypnotherapy, and that's going on
mm-hmm.
now with more and more children, this mindfulness practice in school and so forth, you can become your full self. It's not like
Oh
what
yeah.
happens to your body is going to be, you know, um, is going to deter your having a full life. I mean, I believe that.
Yes, I believe that too, but I also believe that you have to see it, right? Because if you're not made aware that you can come into your full self, and you have this belief in your mind that, well, I was born this way, or I came into the world with these disadvantages, I'm not going to be able to exceed this,
Yeah.
where if you can get to that place in your mind to know that, no, this isn't it, that you can overcome this, it's going to take some work. But, it, to me, again, that's even with like what I was saying about moving over, having that transition space of saying, I am at peace with where I'm at and I'm ready to move on and transition out of this world where people, I've heard people say they gave up the ghost, or you know what I mean, where you're saying, okay, I'm releasing this thing, I'm ready to go and leave peacefully. you know is a different, it's just so many battles are fought in your mind, I guess, is my thing. And if you can't see yourself whole, you can't see yourself healthy, you can't, if you can't see those things, it's much more difficult, um to get there. I guess is my point. You have to be able, which is what I think, I don't know a lot about the hypnobirthing um and I would love to learn more about that from you. Um, but even I just feel like we've been taught so much that birth is that pain is associated with it. And if you can unlearn that somehow or come on the outside of that to where it doesn't have to be it could it's more hard work than it has to be this, you know, horrific, painful
Well, we don't.
Hollywood theatrical
Yeah.
production of bringing a life into the world. I don't know. I just your mind is a big space, you know.
Yeah. Well, I mean, there's lots of work in that direction. We used to have that birth without pain, birth without fear. Then there was the
Hmm.
orgasmic birth movement, etc. And um, breath work with birth. Embracing the pain. What we do as a society is we avoid pain, right?
Yes.
So we avoid it. So we don't even know where to start when it comes to childbirth pain, right? It's what
Mm.
do you even where do you even start with that? I know. Yeah, I had very different experiences with my four childbirths as far as pain goes. But I think I think coming to terms with pain and really being able to work with your body. I mean, a lot of people sit in their bodies like it's a sack of beans. Like they don't really
Okay.
they can't breathe, they can't, feel any energy flow, they, don't know how to move harmoniously, and
Right.
then you're supposed to give childbirth, right? And this is I'm not
Yeah.
even talking about like weight or thinness. I'm talking about being in your body, having contact to your body, having
Hmm.
experienced your body, or a lot of women who start to breastfeed. And one of the things about this talk together is that, like, you use the word candid,
Hmm.
right? Wouldn't it be nice if we could say things candidly? Like, for instance, a lot of women are really uncomfortable with their breasts and they've never touched their
Hmm.
breasts before. And now
Hmm.
these breasts are just supposed to function like a machine. And it's very uncomfortable, right? So
Right.
birth is a completely different experience if you own your body,
Mm.
and breastfeeding too.
Yeah. That's big. When were your babies born at home, Hillary, or in the hospital?
The first two were breech, so they were born in the
Okay.
hospital,
Okay.
but the second two were born at home.
Oh, fun. So fun. We'll have to dig into that a little bit more about your various birth experiences too. That would be a interesting thing to talk about. Just the differences in birthing at home and birthing in the hospital for you. Do you feel like it was large large differences? And when you say they were they breech and needed to have cesareans, or were they breech and you actually were able to have them vaginally breech?
I had vaginal births. So I had the only doctor in Switzerland who would do a breech birth, but he would do it in the hospital.
Okay.
So,
That's so cool. That is so cool. That's so cool. That's so cool. It just, I don't know. It just amazes me that we don't teach that anymore either. Where they used to teach doctors how to deliver a breech baby. Um, that's not part of the training. It's the training is if it's
yeah.
breech, at least in the Western society, that you're gonna have a cesarean. So I don't know.
Yeah, he was totally amazing. He was an elderly Hungarian doctor whose uncle, I believe, had been a gynecologist in Hungary and had done it the old way, always at home, and he'd been assisting birth since his childhood. And yeah, we were very lucky that way.
Oh, that is awesome.
Yeah.
That is definitely a blessing because that's not an opportunity that is afforded to most American women.
So we were going to talk about something that you very cleverly named cookie cutter medicine. That is this idea of the one size fits all, right?
Yes. Hmm.
We already talked about one instance where I think we should already be treating first time mothers specially. I think we
Yes.
should be really encouraging first time mothers in different skills and relaxation skills and better nutrition and supporting liver detoxification
Hmm.
and avoiding electromagnetic fields. I mean, those are just four little things. Also, avoiding household things like shampoos, perfumed body cosmetics, all of these things that your baby is sucking up like a sponge, right? Goes into your bloodstream, anything that passes through the placenta, your baby is getting all of it, getting your heavy metals, right? If getting trans fats from any margarines and uh, vegetable vegetable oils that you may have been taking. So
But those
mothers,
are things that any mom should be doing, though, right? Avoiding those things. It's, we say especially for first time moms, but that to me is anytime really during that childbearing period, if you are working on or planning to continue to have multiple babies, uh, avoiding those things, you know, in my opinion, is always a good thing. I mean, I remember with my oldest, I used to wear for many years. I wore a relaxer in my hair. So I'm a black woman. So to for those that aren't aware of what a relaxer is, we always used to call it perms. Uh, People call it creamy crack, all of the things, because like once you get a relaxer, like you have to keep it going because it breaks the bonds in your hair to that's making it coil and curly. So to do that, you put this chemical on your hair that is straightening your hair, but that is getting into your scalp, it's getting into your bloodstream and all of those things. So I made the decision, that's when I started my locks actually, to cut all of my hair off. Now I did not do it until I found out that until I was pregnant and actually quite pregnant. But I was super, I just was, for me, it was I'm glad that I did it, but for me at the time, it was more of a convenience to not have to keep up with it every 6 weeks. Um, but no one told me how damaging it was for me to continue to put those chemicals in my on my hair, in my scalp every 6 weeks, and that those things would, you know, could possibly affect my baby because those are chemicals that are going into your body, into your blood system. And I don't think that we as women really a lot of times don't think about the hair color, the type of shampoos like you mentioned, um the different things that we do, um that are going not only into us, but we're growing humans, and so
mm,
that just is fascinating to me. It's a big conversation to have, um, and a barrier that I am excited that so many Black women are embracing a more natural style and look, and that we can still be considered professional if we have locks or braids or a more natural style. But just the fact that um, yeah, that could take, you're talking about a tangent. I'm not going to go down that road. But when you were talking about shampoos and stuff, that just is what jumped in my mind. All of the chemicals that we use.
I've heard of that before. I've had it explained to me in detail what the procedure is and the chemicals involved and the time that it takes too.
Yeah, it's a lot. Um, but those things, like you said, are so important to look at.
And you also just have,
What are you
as you
eating?
mentioned, hair color.
What are you putting on your body?
A lot of women dye their hair, so
Mm-hmm. Yeah,
it's the same. It's the same deal.
yeah, yeah, yeah.
Not
That's
me.
good.
I'm 65 years old and I've still got my natural color. So
You do?
I have no idea how that happened, but
I have a lot of gray here going on, but my dad is like completely gray, and I would say I probably got my first gray hair in my early 20s. So,
Yeah. Yeah, I
you
think
know,
it's very much yeah, my grandma too, she was like that. I mean,
yeah.
she didn't gray until quite late.
So,
No,
I mean, it's a big lifestyle choice, because you're really going against the grain to make these decisions and these lifestyle choices. And I think that to me is the biggest thing that I saw and reason for me coming out of the medical establishment, right? Because you do have that cookie cutter medicine, that one size fits all type of medicine, in so many things. Of course, um, maternal and infant health is my specialty and my passion. But when we're talking about labor and birth, if we don't need to apply the same methods, standards, well, standards, yes, but the care for a low risk, healthy mama does not need to look like the same care for someone that is not, you know. There's depth, and even within that, what we're doing to be helpful also warrants being picked apart and looked at to, are we addressing why someone may have, say, acid reflux or stomach upset, as me and you have talked about before. And to do that, that would be looking at their oral health, their gut health, those types of their overall digestive health, right? And digestion starts in the mouth. Um, are we going to look at all of that, or are we just going to give them a prescription for famotidine, or, you know what I mean? Are we going to give them, tell them, oh, we'll just, take these Tums, and so on and so forth. I find it interesting that they'll say, oh, well, Tums has calcium. So my father used to just take Tums to get his calcium. And I'm just like, okay, that is not, those
yeah,
aren't like vitamins. Like those aren't, but that's not what we're doing. You know what I mean? But you know, you also have to really start talking about marketing, right? And pharmaceuticals, and how big of a part that they play in medicine, and in that standardization of why we even have this cookie cutter medicine, um as far as just not finding the source, just throwing a pill at it,
well, if
you
you
know.
think about it, the medical industry needs people to be sick to have a business.
Yes, yes,
So they aren't really incentivized to create cures, which would be looking at the underlying conditions and bringing them back into harmony and health. Or
does the medical establishment need people to be sick, or do pharmaceutical companies need people to be sick? Because we've always had the medical establishment. When you're talking about midwives or even doctors that used to come to the house, or different, we've had these healers and people to help, right? So there's that piece of it, but then there's also the piece of that need for the mega machine of medicine, right? That,
that's a really good distinction, but I would argue with you that to the extent that doctors have become kind of like the distributors of pharmaceutica, of pharmacy,
yes,
that they also need clients. So when the doctors stop being able to look at the underlying causes and treat a human, holistically,
right,
and they just are dispensing diseases, then I'm sorry, dispensing medicine, then they also are like an arm of the pharmaceutical company, and they also need clients. So what you have with medicine, and I think you already sort of mentioned it with your aunt in a way you kind of implied it, is that because medication treats symptoms, it in the best case it can slow the progression of the disease,
Mm-hmm.
but usually with like hidden or not so hidden side effects that create more problems down the line
Yes.
that the person might
100%.
not even recognize as coming from the medication. And in the end, you have elderly people who have like, 20 pills that they're taking every
Yes.
day, and each pill is for the side effect of the others. And all
Mm-hmm.
of the pills together are just being toxic for the person overall.
Yep. Yeah.
So
Polypharmacy is such a huge problem. And then also, you know, what I guess I'm agreeing with your argument because I really wasn't putting up an argument for them. My What I'm saying is that yes, having people that are trained in medicine, in herbs, in different ways to help people to heal and to have that extra knowledge, there's a necessity for that. But when you look at Western medicine, it's they're trained to treat disease. So
right.
if you, even if you don't have a disease, they don't know how to do anything but that, which is why birth is treated as a disease, as a problem, right? We have to fix this issue. That or and if you don't have, my aunt that is no longer with us, they said that, well, I think it takes like 12 different things to tick off of a list to say that you have lupus, but she only had like 9 of the 12 things, so then you don't have it. Okay, but what about these other 9 things that are going on? These are still issues, but we're not doing anything to address, those symptoms that are out there. We have to be able to help people to get well, and I feel like that is where we're not. And what you're saying is, when you are that arm for the pharmaceutical company, and when you are, I remember when I was my first time in college, I don't even remember what class it was, but we were learning about the FDA. And mind you, this was 20 something years ago. I don't know if things have changed, but I imagine that they have not. But the FDA did not felt like a medication was safe as long as you didn't have any detrimental side effects, for, I believe it was like 60 years. Well, that's really not that long of a time, right? Especially when you are starting infants, children, teenagers, and even young adults on these medications. If you're not going to really start seeing, that's not safe. You know what I mean? To say that, oh, this is okay, we say that it's safe because it's not gonna kill you for 60 years. So you're saying that, to me, that's ridiculous, right? But that is really, when you're looking at how we are saying if a medication is safe or not. That's the reality of where we're at. And then you also have these different things that we'll put out on the market that we don't really know a whole lot about, and then we backtrack on them. Ranitidine is one of the Zantac is one of the ones that I think is one of my biggest ones that I'm very annoyed about, because for so long I've seen Zantac given to infants for um, reflux and spitting up, and then we pull it because it's causing cancer in adults. Recently, we just pulled it. I think it's been, I don't know, it might have been a year now. But if it's causing cancer in adults, what was it doing to
It's
all those babies?
it's slowing one of the enzymes in the liver so that you cannot detoxify as well. And and
Right.
and so And we've known that for 20 years. I mean, I have a book here about toxins in, a home, yard, and pharmaceuticals. And I read about that 20 years ago.
But how
But,
is it okay though? How is it that we know that information, but that information isn't given to these moms or these providers that are giving it out? Why isn't that part of the discussion? I
well,
guess is my question.
well, it's it's a normal question to ask. The question you're asking is, how is that even possible?
Mm-hmm.
Somehow we've known that it, causes cancer and impedes the body's ability to detoxify. We've known that for decades, yet we're still giving it to babies. So I would argue that that's true with a lot of medications, that we know that there are
Yes.
detrimental side effects, yet we continue to give it. And one reason is because our whole medical industry, our whole doctors, are not given more resources than these medications. And then they are told by the American Medical Association Academy to, they're given like protocols. If they have this and this and this, this diagnosis, then you give this and this medication. And as a
Mm-hmm.
doctor, you're no longer supposed to question that or only minimally question it.
Right.
So we had the
And then if you do
situation.
question it, you end up having to be one of the ones that, you know, end up having to leave when you're dealing with how insurance works and how, again, that's why I called it the like that mega
So you're
machine.
saying you're saying the doctors will be punished if they don't follow in step.
Yes,
Yes.
because that's just like, well, you have to get out in and out in 15 minutes. You can't get to the true problem of what's going on with somebody in that short amount of time, even if you want to. I don't believe that doctors, and I know several of them, that they inherently are out here, that their heart isn't for their patients, that they didn't go into becoming a doctor because they love people and they want to help people. But the machine of medicine, the way that it's set up, perverts that.
Which is
And
why you have so many suicides amongst
mm-hmm,
doctors and
yeah,
many doctors
it's
quitting, and
mm-hmm,
because they
it's
can't, it just feels wrong. If you have that heart to want to help people and then
yeah.
you're in a situation that doesn't allow you to do that, how frustrating is that?
I just, yes, it's very very difficult. And I know I said it earlier, but being even being a lactation consultant in the hospital versus being a lactation consultant to where I'm going to people's homes and working with them is such a completely different experience. And even with me being online and talking to someone, when I can talk to you and watch what's going on for an hour and a half, you know what I mean, and really
Mm.
get down to what's going on, and we can follow up in a week or so, that to me is more efficient than what I was able to do in the hospital. I have 15 minutes and I gotta, I'm a lactation consultant. There's however many women on the floor. I come to your room. If that baby is sleeping or you're sleeping or that baby isn't ready to eat right then I can't sit there and wait. I can't sit there and have a conversation with you. I'm gonna say, oh, okay, I'll come back and check on you guys. And that's only if I get through all of my other people and am able to get back and swing around to you. So many women that I talk to say, oh, well, the lactation consultant came in for a second, but the baby wasn't hungry, or the nurses were doing something with them, and then I never saw them back again. And that is a lot of times the reasoning for that. Or you'll have, places where lactation only works, 8 to 5 or 9 to 5, Monday through Friday. Lactation isn't there overnight. Lactation
And
isn't
not there on the
there
weekends.
on the weekends. Exactly. That's
Yeah.
what I was gonna say. So those women don't get any support. You know what I mean? And it's not.
In a crucial time when you need it, just when you need it.
Yes,
It's that, like, this is when you need it, not then, right?
yes, and that's not the fault of the nurse or the lactation consultant. It is the way that it is set up. You know what I mean?
Yeah.
And that to me is the problem. If we don't change the structure of the way that we practice medicine, we're going to continue to, and this is my opinion, do harm. And that's not what we're supposed to do. You know what I mean? Because if someone is looking for us to help them and we're not able to because of time or because of the way that things are set up, that's a problem. You know, if I can't check back on you and you're hemorrhaging, but I have my hands full because I got too many people on the floor because of the way that things are scheduled. And I have seen that. I've shown up to work, and there have been, I won't say that, I can't say specifically in a labor and delivery situation, but I definitely have been on a med surg floor where there were two nurses and I had one side and they had the other side because there was nobody else to see those patients. So, or been in the NICU to where we have all of these babies that have to be taken care of, and it we need, there has to be a better system. The system itself is broken, um, just for the sake of me not sounding like I'm throwing my colleagues under the bus, because that's definitely not what I'm trying to do. But I definitely think that our system is broken. We have to focus more on teaching people how to take care of themselves, so hopefully they don't end up in the hospital. Is my that's my goal at the moment. It's like, if we can just keep you out of the hospital, um, people would be so much better off. And that is going to take us learning how to eat the way we need to, rest the way we need to. That's Ruben. It's my rooster. He's announcing himself. Um, grow humans, you know what I mean? And all of that to me is super important. And it's not just about food, it's not just about trans fats. It's even about, I was at a point in my life when I was pregnant with Agape to where my home life wasn't the way that it was with my other two children. And when you are in a constant state of stress, or if you're in an abusive relationship while you're pregnant, all these different types of things, having, we shouldn't be in a situation to where we just are consistently flooded with cortisol, right? And the cortisol is your stress hormone. That is not, and that's your fight or flight hormone. We shouldn't just be in fight or okay, we shouldn't just be in fight or flight all the time. As I said, flight, my chicken just kind of flew off the chair there. It's not healthy. You know what I mean? And Hilary, I'm sure you can speak to what that does in the body. It's just not the way that we were meant to function, and it's definitely not the environment that you want to grow a human in. And you'll see a lot of those effects, on that child. And I can see it in my own children, um, in their personalities and different things like that. And to me, those are things that also need to be talked about. I feel like people don't want to take ownership for their own behavior, and things. Um,
So I want to
and
give
I'm
them a
not.
little bit of an excuse here. It's not really an excuse, but the way that we're brought up in the United States, at least it was that way back when I was growing up, and I think it's the same way too, is that we're told we're basically healthy and we're told we're basically resilient. And I remember hearing that, oh, there are these studies on animals, toxins, animals, but humans are not animals. We're stronger. We react differently. It was like
Mm.
it's taking humans out of the category of being a, a vulnerable animal,
Mm-hmm.
actually,
Mm-hmm.
right? And putting us in some category where we had some strange resistance. Or I remember being told that, what we put on our skin doesn't go on our body,
Mm.
for instance, and of course we know that all of that is not true today.
Right.
But I think there's still that attitude that, like,
Well, we know it, but so many people don't know it. So
right.
many people don't know it.
And these are just basic things, right? It's
Mm-hmm.
like my environment doesn't stop here, right? My body stops here, but the air that's here, I'm is going through my pores. It's not
Mm-hmm.
only going through my nose and through my lungs. The smells, mold, anything
Mm-hmm.
that's in my environment is in my body too, right? And my liver is dealing with it, my kidneys are dealing with it, and at some
Mm-hmm.
point, that can get to the point where it can't deal with it anymore, right? And
Mm-hmm.
I read recently that I think it's 45% of millennials now, those are adults in like their mid 30s to 40s, have a chronic disease.
Yeah.
So you see all
Yeah.
of this chronic disease that didn't exist when I was a kid. Like adults were alcoholics and they were smokers and they got cancer, but you didn't have all of these other kind of strange, bizarre chronic diseases that everybody has
And
today.
so many of them are dying before their parents.
Wow, yeah.
And that is unreal to me too. That and I think I read somewhere, I don't know, some article where they were talking about um this generation being one of the first to, not live as long as their parents. And that's a new thing too. You know what I mean? And I just can't imagine not.
You want to have that idea, right? That you're
Yeah.
you are going to die before your kids. Like
Yes.
there's a
Yeah.
progression of life that you expect
Yes.
to
Exactly. That
occur.
progression.
Right, right. And it's very upsetting when you recognize that events are
Mm-hmm.
occurring that are curtailing that lifespan. And
Yes.
when you have those chronic diseases, it doesn't just affect the body. That's bad enough. It also creates a lot of brain fog, right? So you have people who are chronically fatigued and who feel like they can't really think clearly.
Mm.
And I've been there
Mm-hmm.
because I had Lyme disease and brain fog and Lyme disease. They're like that. So I
Mm.
know I have a lot of sympathy for people who go through prolonged periods of brain fog with their chronic disease. Um,
Mm-hmm.
so
But
what?
I love circling back to what you said about us being able to change. You know what I mean? Just because you've got this chronic disease, just because the statistics show, or this, they're saying that, this generation is going to die before their parents. That doesn't have to be the reality for you and your children, right? So a lot of what we're doing with the talks that we're having, and my hope, um, is that we're giving people the knowledge and the information to help them to change that trajectory, right? To give them those tools that say, okay, this may be the way that you were headed, the road that you were on, but we're going to give you the tools to come off of that road, go the other way, so that you can be healed and whole and healthy, in your body, and own your body and know your body, and be able to not just be in your body like a bag of beans, and to be able to feel your body, and know when your body is like, oh yeah, that was nurturing to me, give me more of that.
Very good.
And to be able to listen to your body when it's saying, didn't like that, don't give me any more of that. And instead of saying, yeah, but I liked it, so I want to give you more of it, so I'm going to take this pill to mask the symptoms of you telling me that you don't want that, I'm
Right.
just not going to give it to you instead. To be able to listen to your body and know that, okay, I don't need that for me, so I'm not going to continue to break my body down by doing that, or even mentally, um, separating yourself from those negative spaces and people, if that's what you have to do, learning how to set boundaries, um, but set boundaries in love. You know what I mean? Of course.
So what you're saying, if I understand correctly, is that sometimes in order to feel ourselves, we have to create a healthy boundary towards community people who are in fact creating a situation that makes that difficult.
100%,
Yeah.
100%. It's not.
Right.
You have to. You even you don't stay in an abusive space.
Sometimes it's not an abusive space and we think it is. That's a difficult one.
I see that. I see that. I
Like,
guess I was speaking more physically abusive, but I definitely I feel where you're coming from. That's a fine line. Um,
so sometimes we have to take a step back and really
mhm,
look self-critically at how we're um, understanding ourselves and understanding
mhm,
the people around us. Be self-critical
yeah,
about it and really question ourselves. Look deeper, look further
yeah.
before
I
you
can see
kick
that
people out of your life.
because your experiences affect the way that you take on.
The way you interpret people
Mhm,
and
mhm, 100%.
yeah,
Yeah, I can see that too, and that could actually, in some cases, that actually can really be dangerous, because when people come, I know that I've seen in cases where with myself, where I've been damaged, I my defense of it is, when I come into a situation where someone else isn't trying to damage me, I'm looking at them and I may interpret that as, oh, da, 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 and that's not what they're doing at all. You know what I mean? I'm assuming that's going to happen, but that wasn't their intention.
right.
That was, I expected it to go down that road because of my past experiences, but then I wasn't giving that person the room to show me that, no, this isn't me. That was not my intention. So I had to, take that step back and look at myself. And it, honestly, that even goes along again with being in your body and knowing yourself, like you said. You know
Yeah.
what I mean? Being able to look at yourself, not defensively, but to say, okay, objectively is the word that I'm looking for with that. To be able to look at yourself objectively and make sure that, you're not projecting something onto someone else
Yeah.
is.
Or the words from the mindfulness scene are to respond to rather than to react to.
Uh-huh. Yeah. Yep. Yep. Yep.
So we're often reacting, and most of us come from a background with some kind of abuse or trauma, or and a lot of the mothers who come to me for help have had a really bad relationship with their mothers.
Mm,
So
mm,
so that relationship is feeding over into their relationship now with their babies, and that sense of you know insecurity about themselves as a mother, as a person in this new situation. There's a lot to do with that
mm,
relationship, and you'll see a lot of times. I mean, I experienced this with my mother. She was like I guess I'm not real sure how this works, but I think she was a second generation feminist,
mm.
and she hated men so much. And I took a lot of that on, and I had to really work through that. I really had to work through that, like how much of this is real, what isn't. And I would say, that was very difficult.
Mm.
Takes a while to work through,
Yeah.
like to find out who are you and who is the other really,
Mm-hmm.
rather than filtering just through your own mother's experiences or your grandmother's. We talk a lot about generational healing these days, and I think it's a really interesting idea and kind of work. But
It is.
anyway, all
It's
of these things, and then you have your baby, and maybe your baby reminds you of your uncle who molested you
mm,
when you were a baby. I mean, who knows? Anything's possible. So there's in those that early time after childbirth, there's so much going on. It's so subtle,
mm-hmm,
and and to abandon mothers at that time, to not have a system that responds to us in that transitional period, right,
mm-hmm.
accounts for, I think, a lot of the social problems we have today.
Yeah, I have had situations where not just early on in breastfeeding, but maybe a few months in, and depending upon the age of the sibling, where it's been where that mom may have been molested at 3 or 4 or 5 years old. And when that sibling becomes that age, at that point, it becomes difficult to breastfeed that baby, because all of a sudden, whoa, I was this age when this happened to me is triggering so many negative feelings in my body that I can't I don't feel like I can continue to breastfeed this baby,
Yeah,
and
right.
so many things that, we just really don't a lot of times think about when it makes it's difficult, um again back to cookie cutter medicine and the medical establishment, right? When they say, well, you're breastfeeding, 2 or 3 visits should be fine.
Yeah,
Okay, well, that 2 or 3 visits could have been, even if everything is going the way that it should go, maybe a breastfeeding education visit, um, a hospital, a right after baby is born visit, and then once your milk comes in, or if you had, any type of engorgement or mastitis visit. But what happens when this baby is 2, 3 months old? You know what I mean? Or if your supply starts to bottom out, between months 2 and 4, or if you have some of these issues that I was talking about with the siblings, to where now mentally there's something going on as to why you don't feel like you can continue to breastfeed, and you may have a 6, 7, or 8 month old. Those are still times that you need a lactation consultant, or some breastfeeding support. And it's when the medical establishment, insurance, cookie cutter says that, oh, well, you don't fit this mold, then you don't get the help that you need, right? And so then that takes me back to saying that we're doing harm, because you deserve that support, you deserve that help. You know what I mean? And to say that,
yeah,
yeah, to say that, well, I can't give it to you, even though you're paying for insurance every month, we're not going to cover you past this age, or this many visits, because this is what we believe breastfeeding is, when the World Health Organization says that you should breastfeed for at least 2 years. So if the World Health Organization is saying that you should breastfeed for at least 2 years, then you should have at least 2 years worth. You should be able to get support for
that's
at
right.
least that amount of time, and really at least means and then some, correct?
Correct.
Because
And I think it's
biologically.
yeah, and like what you were just saying, those mothers, it sounds like they also need psychological help, not in the sense of, oh, they're mentally ill, but like the work that I do with hypnotherapy, which involves a lot of somatics, which involves being able to tune into those feelings of
Mm-hmm.
discomfort in your body and release them. Right. So
Yes.
if you don't release them, they're just there, and they're going to be recurring, and they're not going to be helpful. But you can release them.
Yes, but having a provider, having a lactation consultant, having someone to even have enough knowledge to make that referral, outside of who do you go to at 6, 8, 1 year old about breastfeeding? You're not going to go to your obstetrician, because you're not seeing your
Right.
OB, right? At that point,
Right.
you're not going to go to your ped, because your pediatrician can't treat you. And your normal average family practice isn't going to have any idea. You know what I mean?
Sure.
So it's, to me, it's a whole
Absolutely.
that
Yeah.
that needs to be, you know, addressed. And I say that because I, in private practice, see so many older babies. The majority of my clients are older babies. And I know that that's the same thing that Jen says, you know, speaking of Jennifer Tao, like Jen always says the majority of her clients are older babies. And I truly believe that there's not enough people out here that know how or are comfortable with working with older babies, you know, and
Problems with
it's,
older babies.
yeah, and there's so many of them. There's so many problems of let me rephrase that, older breastfeeding babies, right? Because older breastfeeding babies fall in this category of, you know, the obstetrician is gone, we got the pediatrician, and you know, it's a
So would you
it's an
say that
interesting space.
the babies themselves don't have more problems than the not breastfeeding babies, but because the problems are covered up by the bottle and formula feeding, it's just not as clear. Whereas the same baby is breastfeeding and they're having suck issues or they're having eczema or other problems. What are the or tongue tie? What are some of the problems that you're seeing with older babies?
I would say the majority of the issues that I see with older babies, I will see moms where they were having no pain, where maybe when that baby is now starting to turn over or starting to crawl, you may have pain on one side now where you weren't having pain on that side, you know, and that may be as simple as that baby may need some body work. You know what I mean? Or
Mm-hmm.
you know, that baby may need a chiropractic adjustment. That baby may have, you know, may need whatever that baby may need. But that mom, all of a sudden, who wasn't having pain on one side or the other side, or that baby will have a side preference, where it wasn't like that before. I see that as well. I see a lot of tongue and lip tie in older babies. I see a lot of moms who were able to kind of push past issues in the beginning, especially moms that have breastfed before. Um, and then so their bodies already know what to do, that like muscle memory. So they make milk because they know how to make milk, and they're passively feeding these babies. But then when these babies are older, say 3 or 4 months, and they really haven't been driving that supply, I see those babies all the time. And I will say that I see more, which makes sense in my head. I see more of those babies where the moms are stay-at-home moms than
Mm-hmm.
my moms, they go back to work. Because my moms, they go back to work, usually you're going back to work around 3 months, if you're lucky, somewhere in between 2 to 3 months. So you're pumping all day when you're away from that baby. So your pumping is really what's driving that supply. It's not your baby that's driving supply, but you have no idea that your baby's not driving supply because you just kind of been on, your body's been on autopilot, and then now you're pumping. So that is carrying you through until
So
you're done breastfeeding.
right, right. So just to
But those,
kind of explain it a little bit, that the first couple of months, the body is kind of the female body is more actively producing milk, and after a certain time, it's the muscle tone of the baby's mouth and the suck mechanism that's supposed to then be maintaining the supply. So
right. So
babies
that's where
can
that supply and demand, when you hear lactation consultants talk about that, that supply and demand really comes in at. But when it's more hormone driven, and that that endocrine system, the reason why we used to give, and I don't know, we might still, I guess I just don't deal with it anymore, but you know, tell moms we would give them medicine to dry their milk up if they didn't want to breastfeed,
right, right.
right? Because your body is okay, because your body is going to make milk,
It's
right?
all set to
um
make milk. Yeah.
yes. So with that's that mechanism that's happening that first few months. That's what your body is doing. But once you kick over, and that's usually between that 2 to 4 months to that true supply and demand only, if that baby can't actively drive supply on their own, then you'll see those moms, you'll see their weight start to plateau. You'll see moms supply start to go down. To me, that's probably the reason why we started making baby food around 3 to 4 months. When you go like to the different stores, you'll see the purees available at 3 to 4 months. And I believe that that's because, moms start to see this kind of drop in supply. And so those babies are hungry. That's when we started, putting the rice cereal and milk and all these different things to kind of be at that point to where they're hungry, but we're not making enough for them. And instead of really having a way to look or understanding what's going on with that mom, you'll have moms that'll say, oh, well, I ran out of milk. Well, you don't just run out of milk. There's a reason for that. And so, that to me, even with just, but I don't want to jump into all of that because I actually have to go. We just have to, you asked me older supply issues, that older baby issues. Those would be the issues that I see. Colic, reflux, moms losing their supply, side preferences, tongue tie, and most of those things go along with tongue and lip tie as well. But those types of things, their weight gain plateauing, or them starting to lose weight, which still goes along with moms not having supply. So I work with a lot of those families to help them to get where they need to be. And there's so much around that, and it's
And
difficult.
each of those is a discussion of its in itself.
Yes,
So
yes.
we'll
And
have
then
this
what they
discussion.
do
That'll
is
be
they go
great.
to the doctor, and the doctor or even the nurse will say, oh, well, it must be hormonal, so you need to start supplementing formula. Because no one, that's my point of saying that they're not getting the help and the support that they need, because no one is really set up to work with that age group. So our fix is, this baby is losing weight, you need to start feeding it.
Mm-hmm.
Feed it
Right.
formula, put the rice cereal in it, give it the puree, feed it, when really they shouldn't have food, right? Until that 6 months, they're
And
sitting up
all of
on their
those
own in the
problems that
refrigerator.
you were mentioning, the reflux and the tongue tie
Mm-hmm.
and the tension on one part of their body and all of those things, they're key to actually resolve, and you can resolve them at this time if
Yes,
you have the attention. And if you resolve them, that's real preventative medicine, right?
it is
You are
100%.
preventing problems that will probably develop later on,
Yes,
growing out
I
from that
agree.
root of disharmony.
Yes. So I'm excited about what our discussions that we're having. I feel like there's so much to talk about. We could pick one little piece, or we could even continue talking about the medical establishment. But I'm excited to come back and have more conversations with you. We are planning on doing this for right now once a month, and then we'll see how it goes. So yeah, I'm excited to have some regular viewers, and you guys hit like and share and do all of the things. And
You're good. I would have forgotten.
yes, yes,
Yes,
we
hit like,
gotta,
share, subscribe. Hey.
yes, that's right. Hit like, share, and subscribe. So for our commercial pitch there at the end. And thanks everyone for joining us. Thank you, Hilary, for taking your time out to do this with me.
Yeah, we'll learn it. We'll get better at this. This will be fun.
Yes,
This will be
we
great.
will. We will. Okay.
Okay.
Well, do you mind stopping the?
Right. I'll stop the recording.
Okay.